Did you know that 50% of people worldwide have the problem of bad breath? In this video, we'll be covering 10 facts about bad breath, including the warning signs that you need to see your doctor. Let's dive in. What is the medical term for bad breath? The medical term for bad breath is halitosis. Now, in this video, when we say bad breath, we're talking specifically about how there are different types of halitosis, which we will touch upon later. What causes bad breath? The primary cause of bad breath is poor oral hygiene. Poor oral hygiene allows bacteria to grow and thrive on the tongue, teeth, and gums, causing bad breath. However, there are also secondary causes of bad breath, which may or may not be related to the oral cavity. For example, many systemic diseases such as diabetes, kidney disease, and liver disease can cause bad breath. Likewise, certain foods like garlic and onions can also cause bad breath. Other causes of bad breath include dry mouth, smoking, and even stress. How many types of halitosis are there? Generally, we classify halitosis into 3 types. Bad breath with a distinct odor, bad breath without a distinct odor, and underlying systemic disease. As mentioned earlier, there are many causes of bad breath. In some cases, bad breath may have an obvious cause, such as stinky tofu or a sinus infection. And in other cases, the cause of bad breath may not be so clear. If the odor of bad breath has a distinct smell, such as rotten eggs, it may be due to sulfur compounds produced by bacteria overgrowth on the tongue or decaying food particles between the teeth. On the other hand, if the odor of bad breath doesn't have a distinct smell, it may be due to a dry mouth or a sinus infection. Finally, bad breath may be a sign of an underlying systemic disease. Some systemic diseases that may cause bad breath include chronic kidney disease, uremia, hepatic encephalopathy, diabetes, mellitus, among others. What is the evidence-based way to prevent bad breath? You don't need to spend hundreds of dollars on fancy mouthwashes or toothpastes to prevent bad breath. The evidence-based way to prevent bad breath is by maintaining good oral hygiene. This includes brushing your teeth at least twice a day, flossing once a day, cleaning your tongue, and using an antimicrobial mouthwash if needed. In addition, you should also visit your dentist regularly for dental checkups and professional cleaning. Are there any treatments available for bad breath? Yes! There are many treatments available for bad breath. If your bad breath is due to poor oral hygiene, then improving your oral hygiene regimen may help reduce bad breath. This means brushing your teeth at least twice a day, flossing once a day, cleaning your tongue, and using an antimicrobial mouthwash if needed. In addition, staying hydrated and chewing sugar-free gum may also help reduce bad breath. Visiting your dentist regularly for dental checkups and professional cleanings is also important. If the bad breath is due to an underlying systemic disease, then treating the systemic disease may also help reduce bad breath. When should I see my doctor or dentist about my bad breath? It is important to see your doctor or dentist about your bad breath if it persists despite good oral hygiene. In addition, you should also see your doctor or dentist if you have any warning signs or symptoms of an underlying systemic disease, such as persistent dry mouth, excessive tiredness, pale skin, yellowing of the skin or eyes, swelling in the legs, frequent urination, unusual weight loss, and blurred vision. Here are some common bad breath myths versus facts. Myth no. 1. Bad breath only happens in people with poor oral hygiene. While poor oral hygiene is the most common cause of bad breath, it's not the only cause. Many systemic diseases such as diabetes, kidney disease, and liver disease can also cause bad breath. So facts, everyone can get bad breath regardless of how good their oral hygiene is. Myth no. 2. You can get rid of bad breath by just brushing your teeth. Brushing your teeth is important, but it's not the only thing you need to do to get rid of bad breath. You also need to floss, clean your tongue, and use an antimicrobial mouthwash if needed. Myth no. 3. Only people with stinky breath have bad breath. This is not true. People with bad breath often do you unrealize it because they breathe close to their own breath all the time. And finally, myth no. 4. Bad breath is not a big deal. Bad breath can be embarrassing and can affect a person's social and work life. So it's important to take action. How does taking care of my oral hygiene help my overall health? Taking care of your oral hygiene is important for your overall health for several reasons. First, poor oral hygiene can lead to gum disease and tooth decay, which can cause pain, infection, and even tooth loss. Gum disease has also been linked to other health problems such as heart disease, stroke, and diabetes. In addition, poor oral hygiene can cause bad breath, which can affect your social and work life. By taking care of your oral hygiene, you can avoid all these problems. This means brushing your teeth at least twice a day, flossing once a day, cleaning your tongue, and using an antimicrobial mouthwash if needed. You should also visit your dentist regularly for dental checkups and professional cleaning. By maintaining good oral hygiene, you will not only have a healthy mouth, but also improve your overall health. Thank you for watching our video about 10 facts about bad breath. We hope you learned something new and useful. If you have any questions, feel free to leave them in the comments below. And please subscribe if you haven't already. We release new educational videos every week. Stay healthy and take care.